Hi everyone, greetings from National Skills Network. Some of you who have been following us on YouTube and also on our website, and of course through our newsletter and various other updates, you would have seen that we have started a small initiative on drones because we foresee a lot of need for skilled workforce and also scope for entrepreneurship in this sector. And drone is going to touch us in many ways. And one of the sectors is healthcare. So today in this talk, we are going to look at a few applications of drone in the healthcare sector and how it has huge potential to benefit people who live in remote places especially. So in that connection today, we are meeting with Ms. Priyadarsini Suresh, who's from Public Health Foundation of India. And she's a very interesting person who's actually completed the drone training from the Telangana Academy of Drones and also was in the news being one of the early women drone pilots in India, which was featured in many newspapers. So we are glad to interact with her today to learn more about what is going to be the future scenario when drones are going to be applied in the healthcare sector. So Priyadarshini, first please tell us more about yourself, and then I think we can look at the importance of drones in the healthcare sector.
Yeah. Hi everyone, this is Priyadarsini Suresh. I'm a researcher at Public Health Foundation of India. In this we have a department, HR Rapid Lab. In our department focuses more on the universal primary healthcare at the doorsteps of the people. And while doing this studying regarding to the universal healthcare at the people's doorstep, we realized that there is a logistic issues also involved along with the people's present there. Then we came to realize that the drone is as a mobility, the drone can be very helpful to the people. So that's where we started showing and thinking and doing it's how it's gonna help and when. Actually, we are the first people in India who stick a box of medicines to the drone and flow in PHCs. It's all way back to 2015. From then we are been working on the drone. Actually, we are been more working on the specification. It's like how much drone should carry, how much payload it should be able to take, and how far it can be flying. Because as per in India, we say that villages, but they are very far. They are not nearby. So short range drones are not useful to us. We should have a long range drones. So that's why we came up with how it should be a modular, or how should be the temperature should be there, because it's not like one cooling box, because every medicines, every vial should have a different temperature. So that's how this process of developing and knowing the specification of the drones has been started, and still we are doing it. So hopefully future we think we will be able to build a long range heavy payload drones which will be exclusive for the healthcare.
Yeah,
So
great. Yeah, so Priyadarshini, recently it was in the news about medicine from the sky. I remember reading a news item from Arunachal Pradesh, and you were also mentioning a similar experiment in Vikarabad in Telangana. So this shows that there is a relaxation of rules from the government and the liberalization of policy and various other things that happened over the last few months. How do you think this will have an impact on, like you just mentioned about delivering medicines, for instance, so how is it going to impact in future? Are there positive developments happening in the field, especially from your organization?
yeah, actually the rules should be a bit looser, and then it will be very useful, because this is a very new field. Until we do it trial couple of times in the ground, we can't say that. So, and the government taking a huge part and interest in these things for projects like a medicine from the sky gives the people that a lot of scope to think them beyond that only you can survey, or only you can do a photography or a travel videos. Actually, there is a huge requirement in other sectors also, like in healthcare also. So that's what the people interested has come up with a drone taking a photos or a videos to come to the actual use scenarios, like using for a delivery of the medicines, which is very much needed in India, because not only in the remote areas, if you see in every state you have like a hard to reach areas, hard to reach areas. So if you're doing that thing, it will be very useful to people also,
Yeah, correct.
because every state has not only the, we generally think that the only the northeast or the very difficult places, but even if you see that in Vikarab, in Andhra also, if you see Andhra or Telangana, there are few places, if you look into the maps, they are like a hard to reach areas, and it will help the people also to think that drones, instead of first building the drone and thinking what to do with it, how much, because once you build it, the what payload you can add to it will be very much reduced. So instead of that, people will think that people will start building the drones based on the use cases.
Okay.
So I think that change will happen, and people can think of lot of other ways also to develop. And so I think government playing an important role and starting this type of projects are very useful to the people also, because of relaxing. End of the day, government has to relax so that people can, they can actively involve and develop all these things.
Yeah, you just made a very important observation about not making drones upfront and then deciding what to do with it. So, if you look at the healthcare sector, what is your idea of how one can go ahead? So, is it like I decide what is going to be, sent through this drone? Maybe it's the weight or the size or something, and then you decide on how to go about. So, can you please make it a bit simple and clear for all of us to understand?
Yeah, for it's come to the healthcare, it's like very unique, because if you see PHCs, when we say that we'll send the medicines from district hospital to the PHCs, just not one medicines. You will send vials, injections, medicines. You should have like other things also, like glucose or any devices or anything, and everything should have a specific temperature. That is the uniqueness of the healthcare. Everybody can't put in one temperature. That means they should have like an individual box,
Okay.
individual temperature control boxes while sending it, and it should be very rigid, that it should not be well put dropping or keep handling it. Nothing should happen to the vaccines also. And while sending to the PHC, you have to make sure that how much one PHC's requirement also. It's just not that how much it can fit. First, we have to come up with the how much dosage is required to the PHC, so that you can, based on that, you can see that at least once a week you should send a drone to the PHC, or a once a month is enough, or a twice a month is enough, so that you can use one drone to the many PHCs instead of building one drone to each. If you imagine it from district hospital, if you have to send a couple of PHCs, then you have to know all this information, so that only you can see that how regularly you can fly the drone to the PHCs. So that type of groundwork we are actually doing and coming up, so that we can say that that's how I think even if you use the drones, it still be sustainable, because that's how, because now it's very expensive also to fly them and to use them for a one trip, for a one while, or a one small tent boxes, or any one boxes. So it has to be helpful to the PHC also.
Yeah. Yeah, so cost is a factor then that everybody will have to, I think, look at. So is it
Yeah.
also like sometimes things have to reach fast? Like we hear about, organs being sent for transplanting, right? Through maybe a metro or something which goes very fast in a city. We have read such news in the past. So
Yeah.
if you compare drone with some such requirement where either something has to go very fast to save somebody's life, maybe, or something has to reach there because you can't reach by road or there is no proper means of transport. So which do you think is more important here? Is it the time, or is it like the reach, or what is it?
I think both, because if you have, it's like a, for a time is very important, because for any, if you go into any accident or anything, we say the 1 hour is a golden period. So anything has to reach in a, everything has a time here. Even if you have to transfer a drone or a organs also, you should have in a time bound. That's why we try, will create a green corridor for the
Yeah.
drone people to carry the drone organs. So it's like I think time is very important, but the issue is nowadays that drones should also fly for a long distance also.
Hmm.
I think next important people, government or people should look into like a flying for a long distance. Now we flying like a for a visual line of sight. I think next should be the beyond line of sight. So
Hmm.
whatever you mentioned, it will be very useful if you have a beyond line of sight,
Okay.
because organs are transferred from one city to other from a long distance also.
Hmm.
So it can't be a visual. I think that should be the next thing people will be start exploring it.
Yeah. Yeah, I think these are really exceptional benefits to the healthcare sector with the emerging technology, like you said. Now, besides this, like you already mentioned, that drones are not just for entertainment or for agriculture or for surveying, but healthcare is a very important sector. So, how do you perceive or how do you visualize things unfolding from now onwards? Now that there have been some trials, is there something like a gestation period or some time there is a timeline, or what do we get to see in the future? And of course, knowing the fact that it is definitely going to be expensive, right? Yeah.
Yeah, I think initially everything technology will look like
Yeah.
an expensive, but as you keep on using it and you're developing it, it reduces. I think the new thing should be we should be focusing on the now drones has been use case. Now it's very clear by the projects we done that it is useful. So
Hmm.
now we have to focus on the specification. Not one drone can be used for everything. Now, if it's a medical drone, it should have its own requirements and specifications. So I think that should be the next big thing. That's what we are also trying to look and trying to convince people and government also. See, we run a trial in two places in Vikarabad and Arunachal Pradesh, and we told that it's useful, it can be done, and it will be useful to the people on the ground also. So
Yeah.
next thing will be like the payload and the distance. So
Oh,
I think that should be the next target for the
oh.
people to develop more.
Yeah, great. So when this kind of things are coming up in future, what would be the need for, let's say, people to study, learn, get skilled? Do you see any such requirements coming up for specific training to happen, for people, or there could be some possibility of people setting up research labs or some data science kind of analysis? How do you see this part of it happening, Priyadarshini, in the coming months or years?
I think that will be the next big thing. We are saying the technology flying of a drones. I think next thing will be that only the skill development. So
Mm-hmm.
we for when you fly a drone or reach everything, then next will be the skill development. Starting from not only just flying the drone, we need a technicians. We need how to maintain the drone, how to maintain, how to put a small changes on the parts, and exploring everything. So I think next will be that part only. What are you saying is like we have to. It's like it's gonna be big. You
Mm-hmm.
because the as soon as you fly a drone, it's not just one people. People generally think that one pilot will fly it and give it. Just not like that. It's like so many people involved. At least to fly a drone, at least 6 to 10 people involved in that.
Mm-hmm.
So if you imagine so much people and workforce is needed as its field is going up. So I think it's very good. People are putting, you will be start putting the up the drone facilities, and the drone manufacturing thing and maintenance will be the next big industries, I think.
Yeah. And how was your training at the Telangana Drone, Academy, and how did it go? And I'm sure you would have enjoyed it. Yeah.
Yeah, it was very nice and very good. I was like, because we are from a healthcare, we thought, can we learn it? Can we do it? But they are very patient. They're nicely telling it. Oh, first time I hold a soldering thing and I did it, join the parts. So it was very interesting. They are telling very nicely, also patiently, irrespective of your background, everything. And that actually they are taking so much time. It's like one to one. They're telling you how to hold, what is there. It's like one to one. They are giving a training. Is like a step by step. It was very good, and it's like for us also researcher, for us to go and explore and get hands-on experience. It's
Mm.
like one of the good thing, and I'm hoping that soon Telangana government will be launching the beyond line of sight also. Then I hope to go and join it if they launch it.
Okay, that's
It
so
was very
nice.
interesting.
Yeah. Yeah, that's so nice. And looking at the developments in the recent past, where we had this geospatial events, remote sensing, drones event, and many other technology specific events were happening. And maybe, the healthcare sector also will be highlighted. And let's hope that happens soon.
Yeah, yeah,
So,
sure.
so besides these points, is there anything else, Priyadarsini, you wish to add? Like one thing probably is the perception that drone training or learning drones is difficult. I don't think it's that difficult. I'm sure within a week you get to learn it,
Yeah, yeah.
right? You get to get trained. And for healthcare professionals to start experimenting with drones, training must be essential, right? They might have to do this hands-on training. So is there anything else you wish to add to all that you said?
Yeah, I think for healthcare persons also should go, and I think that getting a training is very easy. And I think because I did it, so I'm telling it's not that difficult. People can go learn it. While you learn only, you will know that whatever it's how much is possible, how much you can do difference, and what modification you can be seeing. Because while going, doing, sitting there and doing it, you realize it. And next thing, I think after I think the next will be the drone will be more on the healthcare only, I'm guessing, because that is a one sector where everybody wants a universal healthcare. I
Yeah.
think with the help of drones only, we can be the universal healthcare can be provided. So I think that will be the next big thing events, or the people gonna focus on that, I think. And as we are also working with World Economic Forum and Niti Aayog to say that we people should focus on the healthcare and the rules or the drone rules, everything, trying to implement or trying to tell changes, think that we need a long range heavy payload drones for healthcare. So I think that will be the next big thing.
Yeah, great. So I think on that positive note, let's hope that the rules are further relaxed and your vision and your dream for making it a reality also comes true very soon. Thank you so much, Priyadarshini, for talking to me today. Thank you.
Thank you.
Thank
It's
you.
my
Bye.
pleasure.
Thank you. Bye.